Hey, what's going on, guys? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at hairliciously.com to purchase your microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. So as you guys can tell, I am trying to rock the man bun. Hopefully tomorrow or sometime this weekend, I am going to shave the sides so that it's gonna look more cleaner. We'll give you guys an update and keep you guys posted on that. Anyway, in today's video, I wanted to give you guys an update on Clascoterone's phase 2 proof of concept trial of their Clascoterone solution for the treatment of androgenic alopecia in female patients. For those who are new to the Italian company Clascoterone, they are currently undergoing clinical trials for both men and women who are suffering from androgenic alopecia, and they are using their Clascoterone topical solution, which is more commonly known as CB-03-01 or BREEZULA. Unfortunately, we are still waiting for an update on phase 3 clinical trials for male androgenic alopecia, but we did receive some promising news on female patients, which I will share in just a moment. If this is approved by the FDA, it's going to be the first ever topical anti-androgen for the treatment of male and also female pattern hair loss ever since 1997, which was the year that finasteride was approved for the treatment of hair loss. This really is exciting news because while we do have experimental drugs or anti-androgens like RU, things like flutamide, bicalutamide, nothing has really been extensively studied and cleared for the use of humans. So if we were to get the approval, I think it's going to be a tremendous arsenal to add to our hair loss treatment regimen. Because anti-androgens block the androgen receptors, and it also prevents them from activating and mediating their biological effects. One of the main benefits from an anti-androgen like CB-03-01 is that it's going to protect your hair follicles from DHT from attaching to it, but it's also going to leave your body's DHT and testosterone levels completely intact. This means that all of the androgens, particularly DHT and testosterone, are not going to be altered. And theoretically, this isn't going to cause any sexual side effects like low libido or erectile dysfunction because it's not going systemic, which is oftentimes caused due to fluctuating levels of your hormones. So, as far as the updates, the phase 2 vehicle and 2% Minoxidil controlled dose ranging study was conducted in Germany and evaluated the 6-month efficacy and safety of 5% and 7.5% twice daily application of Clascoterone solution as compared with twice daily 2% Minoxidil or vehicle in 292 females aged 18 to 55 experiencing androgenic alopecia. Approximately 70 eligible subjects were randomly assigned to treatment groups or the vehicle. Most were Caucasian with an average age of 40.7 years for the per protocol population. The co-primary efficacy endpoints were number 1, change from baseline in non-vellus target area hair count, and 2, hair growth assessment at month 6. The target area is defined as 1 square centimeter. The hair growth assessment was a study subject self-administered question that provided an indication of the favorability of scalp hair growth compared to baseline using a 7-point scale. So in the clinical trial, surprisingly, only the subgroup with women less than 30 years of age who were receiving twice daily application of 5% Clascoterone solution showed statistically significant differences from baseline in total area hair count at month 6, although the subgroup was not powered to show statistical significance. This may mean that younger people who are typically experiencing hair loss earlier, or if they're in the first onset of hair loss and they end up getting treatment first, may respond better and quicker. And this is usually the case even with Minoxidil and finasteride. The sooner that you guys act, the better you are likely to respond and halt further hair loss while potentially regrowing back miniaturizing hairs. Also, 5% may be more efficacious or recommended than the 7.5% Clascoterone, at least for women, in the same sense that we have Minoxidil 2% instead of the 5% that is used for female androgenic alopecia. I guess there is a rate of diminishing returns between the two doses for female pattern hair loss. But obviously this still needs to be studied more, and once they do release their phase 3 clinical trials, on efficacy of various concentrations. But then again, this doesn't always mean that a higher concentration and frequency is going to correlate to better clinical response. Now, as far as BREEZULA's treatment for male pattern hair loss is concerned from their phase 2 clinical trial results, the 7.5% solution applied twice a day did outperform the other doses in both target area hair count as well as hair width. So for men who are considering on applying Clascoterone, obviously a higher concentration applied twice a day may be the most efficacious. Unfortunately, all of the clinical phase studies have been delayed for a while now due to the ongoing pandemic, and phase 3 trials for BREEZULA for male androgenetic alopecia was supposed to begin early this year, but we still have yet to get a definite answer on when exactly the clinical trials are going to proceed. I'm fairly optimistic about BREEZULA's approval eventually later on the road, since we already have Casiopeia's Winlevi, which was FDA approved for the treatment of acne, and it was their first treatment of acne with a new mechanism of action in 40 years. And for Winlevi, their key ingredient is also Clascoterone at 1%. So I don't really see a reason why a higher dosage wouldn't be approved later on the road for treating hair loss. This would definitely be a huge game changer for those who either aren't responding well to finasteride or dutasteride, or they can't take any 5-ARs due to potential side effects, because Clascoterone is not known to interfere with testosterone or DHT or other androgen hormones. As far as in the clinical trials, there hasn't been any libido or sexual behavior changes. And what's even better is that because of Clascoterone's rapid metabolism and localized activity, it's likely not going to go systemic and cause side effects. My guess is that BREEZULA is going to at least be effective as finasteride and minoxidil, if not better, but it's definitely not going to be a hair loss cure, since it's only going to block the androgen receptors. And I think this is something that people really have to realize. You honestly can't really expect a whole lot from a topical anti-androgen that isn't going to affect the endogenous hormone profile at all. This would usually be more well suited for people who are starting to notice the first signs of miniaturization. And this really isn't something you would want to use if you're, more at an advanced level of hair loss, or even diffuse staining if you're trying to regrow hair, unless your goal is to stabilize further progression of hair loss. It's basically going to serve as a preventative measure. But it's definitely, like I said, going to be a huge game changer if it gets approved, since we're now adding in a different mechanism of action to target and treat androgenetic alopecia. Most people, already see better results when they stack on different treatments. Things like finasteride that blocks DHT. We have minoxidil to stimulate hair growth through the opening of potassium channels, microneedling to induce growth factors. And now we will eventually have this steroidal anti-androgen that has a high level of tolerability with a low side effect profile, and effective at competing at the androgen receptor locally with all of the endogenous androgens. Casiopeia's plan is to begin selling BREEZULA in 2024, although this date is subject to change due to the ongoing delays and lingering pandemic. We also don't know if this is going to be released in Europe first, or if it's going to go global. And as far as pricing, people are speculating somewhere between $100 to $200 USD for a month supply. And that price should eventually go down once their patent expires. Now, there are a few websites that actually sell CB-03-01 in powder form, and some people have been known to mix it with ethanol or PG or minoxidil or stamoxidine. So if you can't wait for BREEZULA to be FDA approved, you can always try it as an experimental drug similar to what people have been using for RU. As far as pricing for these, powders, I've seen them go for like $100 for 1 gram, or even $500 for 10 grams. And in order to replicate, Casiopeia's study, you would need about 3.75 grams mixed into a 50 milliliter vehicle solution to get the 7.5% concentration. So it's definitely not something that's cheap, but it is something that's worth investigating if you guys want to test it out for yourself, if you guys want to get, hold of it. Comparing this to RU 584-1, which is about 1/5 the cost, we know that RU has a better binding affinity compared to BREEZULA, which would mean that RU has a better efficacy. But, it isn't backed up with safety data for us to refer to. And personally for me, for that main reason, I actually choose not to use RU. But anyway, that's all I have as far as an update for BREEZULA. Hopefully we get more information and an update on the progression of their phase 3 clinical trials sooner than later. Like I said, adding a well-studied and well-tolerated anti-androgen like BREEZULA would be extremely beneficial for a lot of people who are suffering from hair loss. And definitely this would open up a lot of options for people who are unable to take certain hair loss medications, you know, like finasteride, dutasteride, even minoxidil, due to potential side effects. So thanks for watching, guys. If you guys have any questions, make sure to reach out via email or in the comments below. I will keep you guys posted as you know, I come across more information, and I'll talk to you guys next time. Take care.